Post-traumatic stress disorder really refers to the initial insult, and that is the trauma. The trauma in PTSD is significant, and it may or may not be life-threatening. In fact, or it may seem life-threatening to the individual who experiences it. It may occur early after the trauma, or the onset may be a little later. When it occurs, it can be a devastating illness. It can be a relatively mild form, or it can be a form that really disables an individual. For example, somebody who returns from the war with PTSD that is untreated and has difficulty distinguishing normal people from the enemy and confuses that in their daily lives. It's extremely important to diagnose and is often undiagnosed. I can't tell you how many people I see who have PTSD who have never been diagnosed and they've never been treated. Well, they've gone to doctors, they've gotten tranquilizers or sleeping pills or something of that nature, but they haven't been treated for the disorder that they have. They haven't been treated appropriately. They've gotten some medical attention, but it has been inappropriate. Some of the symptoms that one might recognize with post-traumatic stress disorder, and probably most commonly, is recurrent memories of the event, where they reoccur during the day and you can't stop it. They keep coming back, avoiding anything that reminds one of the event, going to places where it reminds one, talking about it, driving past a place where something occurred. So people tend to avoid that. They often have nightmares of the event, of the trauma. Those can be frequent and devastating. And they often have flashbacks where they feel they're back in that situation with the same feelings, same traumatized horror that they experienced at the time of the event. There's something we call psychic numbing, where people feel they can't relate to the world in the way they did before. Their feelings are blunted, so to speak. They're a bit detached from the regular population. If you ask a wife of somebody with severe PTSD, they'll tell you there's a difference in how that individual relates to them. And there's something we call arousal symptoms that can be very disturbing. Difficulty with sleep, difficulty with hypervigilance, and that's always being on the alert for any evidence of the trauma or traumatizing influence. So people may look around as they relate to somebody, they're tense, and they're always ready for something that could happen. If you have further questions or would like more information about that, give me a call at 908-305-6404.